Action. So, in this video, I'd like to talk briefly about what it's like living with type 1 diabetes. Now, I'm not going to go on a big tangent about this, but whenever people find out I am a type 1 diabetic, they say, oh, you poor thing, you've got to take injections and you've got to test your blood sugar with the sticky things, and those things are true, but those are the easy bits of being diabetic, man. Seriously, like for me, if that's what all diabetes was, I'd be a happy camper, man. I would just keep injecting, which I do. Well, got a pump, but yeah, those things would be like super easy to do. What is really tricky for me as a diabetic is the fact that it's always on my mind. It's something I'm living with. I could inject myself, my blood sugars could go sky high, and I could feel really horrible for the next 4 hours, and no one sees that necessarily. I'm living with that internal kind of like, oh man, this sucks, and what's happened to me long term, my blood sugars are elevated and that's not good for me, and start thinking about that. Or on the opposite side, if I go out by myself somewhere, or I go for a run or try and exercise, my blood sugar is going to crash, and then you start thinking, well, okay, have I got all my kit with me? Would I be prepared? What insulin do I have to adjust my insulin for the short time while I go running, or what do I need to eat depending on how far I'm going? So what's happening in here, I've got a little diabetic calculator. It sits about there in my brain, and it's constantly doing these calculations. So what I'm trying to say is that there's actually a bit of mental pressure, so to speak, in being a diabetic, and now these things have become kind of ingrained in who I am. But I think, for the non-diabetics watching this, next time you see a type 1 diabetic, just realize that, hey, it's not just the injections and the blood sugar testing that they're going through. There's a lot more, much more, like 95% of the stuff you're not seeing. So, if you see a type 1 diabetic in the street, give him a hug. He'll appreciate it. I'll appreciate it. If you can give me a hug right now, I would take one. And this is not to feel sorry for myself, because actually having, or being diabetic has been a good thing in my life, because, it's made me realize that life is worth living, and that, things are cool. So, but I think this is just a little bit of a, hey, don't always take things for granted in terms of what you think you know about something. So diabetics are cool. Some aren't, but I think a lot are. Thanks for watching, and subscribe if you like this, and let me know in the comments what you want to let me speak on next, because I'll totally do that. So rock on. Cheers.